Good evening, everyone, and welcome to week 3 of food and its effect on mental health. And today we are talking about food addictions. And we have an interesting panel of new speakers just for you who will talk about different food addictions and its impact and also the way out. But before we move on to today's topic, I want to announce something, a good news that we've just received and we would like to share with all our viewers. Pragati has just launched her second book today. And yes, Pragati, please show it. It's called
Thank you,
Hope.
Devlina.
It's a children's comic. It's for children and it has parental guidance. So it can be used as a guideline for parents dealing with issues that some of our children go through. So over to you, Pragati.
Thank you, Devlina. Welcome everybody who's watching us today. Food and mental health have a very intrinsic relationship, but most of us are very uneasy with food. With this thought in mind, for the last month, we've been talking on various facets of food and mental health. Today's topic is eating disorders. So, over to you, Alka. I would want you to share your views regarding this.
Thank you, Pragati. Good evening to everyone. I'm Alka Loya, a psychotherapist and life coach associated with Cornish for the last 15 years. And today we are all here to talk about eating disorders. So first of all, what are eating disorders and why are we discussing them? Eating disorders are illnesses which can be characterized by irregular eating habits and also too much obsession and concern over one's body weight and body shape. Now, why we are discussing is that because eating disorders today are very detrimental and can also become deadly. Broadly speaking, there are three eating disorders. One is anorexia nervosa, one is bulimia, and the third is binge eating. Anorexia nervosa is characterized by an unhealthy obsession with one's weight and just wanting to be very, very thin. Bulimia is when you eat and you eat extra and you compensate by either forcefully vomiting it out or by using excessive laxatives and other things. Binge eating is when you just binge eat and you don't try to compensate for it. So I'll hand it over now to Ashna, who will go over the causes in greater detail. Thank you.
Hi everyone. So, like Alka mentioned, eating disorders are very complex disorders and influenced by various factors. The exact cause of eating disorders are unknown. It's generally believed to be a combination of biological, psychological, environmental factors, and cultural cultural factors. There are various biological factors that come into play when we talk about eating disorders, such as hormonal imbalance, nutritional deficiencies, changes in the structure of your brain, probably followed by an accident or a certain event or some trauma, and genetics, which play a very important role. So, if you have someone in the family who is struggled with an eating disorder or a strange pattern of eating, there is a very high risk of you having a tendency to do the same. Examples of psychological factors include having a negative body image, a low self esteem, obsession with looking perfect, striving for perfection, having a tendency of feeling dissatisfied with your own self, um, and basically focusing on your appearance more than other things. Also, people with eating disorders have a tendency to struggle with other psychological issues such as anxiety, stress, obsessive tendencies, which further thrives their desire to be on a diet or to constantly follow certain regime. There are various environmental factors which also contribute vastly to these disorders, such as dysfunctional family dynamics, a recent breakup, going through a traumatic separation or a traumatic event, any form of abuse, shifting to a new place, to a new job. These are all certain trigger events which may lead to an eating disorder, stress, and then the eating disorder. There are certain professions that demand you to look a certain way, which leads to the obsession, such as ballet or modeling or acting, which focuses on the way you look. Certain aesthetic sports, which focuses on maintaining a lean body for better performances, such as diving, rowing, fighting. So there are various factors such as these which come into play when we talk about eating disorders. It's still being widely and heavily researched as to what exactly causes it. But for now, these are some of the reasons that we know of. Thank you.
Thank you, Ashna. That was very, very informative. And over to you now, Vartika. Can you tell us a little bit about the eating disorder that you want to speak about?
Yes. Good evening, everyone. I'm Vartika here. I'm going to be talking about few symptoms of binge eating disorder and the way out. So emotional stress or distress plays a very important role to trigger this binge eating disorder. You know, symptoms like eating much more rapidly than normal, or eating until you are uncomfortably full, eating large amounts of food when you're not even hungry, and then the feeling of guilt or disgust with oneself are the symptoms that cause binge eating disorder. The way out, there is a treatment that targets disorders like behaviors, body image, mental health, or even a combination of these. These treatments can involve cognitive behavioral therapy, also known as CBT, interpersonal therapy, weight loss sessions, and meditation. A mental health professional can best provide us on how an individual can take up this treatment plan and follow it. CBT will help one identify the negative feelings and behaviors that cause the binge eating and help them put strategies in place in order to improve it. Often one should visit a therapist for more details. Interpersonal psychotherapy is what views binge eating as a coping mechanism for underlying personal problems. For example, relationship conflicts or changes in one's lifestyle. To address these negative behaviors and acknowledge them will definitely help them come out with constructive change. Weight loss therapy is aimed for those who want to lose weight and can reduce binge eating disorders by improving their self-esteem and their body image, which would gradually help them make a healthy lifestyle change. Thank you.
Thank you, Vartika. Now over to you, Manju. Would you tell us a little bit about bulimia?
Good evening, everyone. I think my friends have really given a lot of inputs about, why they happen, how do they happen, genetics, low self-esteem, low self-worth, your attachment to your body image, so many factors, so well put. So there are many types, as Alka mentioned, one is anorexia. The bulimia I want to talk about today. It's an eating disorder which is essentially characterized by frequent episodes of binge eating. And then though these are again followed by extreme efforts to weight loss. Uh, because if I'm eating something, I have this fear that I'll gain some weight. So now what do I do? So mostly either by purging. Purging is vomiting, making yourself, imagine it's such a painful process, putting your finger inside your throat and trying to take out food which you have eaten. Purging is a very, very common thing which happens with a lot of young people. Many a times you must be seeing people eating up in a dinner, you're sitting on a dinner table and some people, they have frequent visits to the toilet. Because once they overeat, they just want to take it out, either by purging, either by taking some dietary pills, either by some diuretics, or sometimes, by fasting, 5 days eating and then 5 days fasting. So a very irregular cycle. Sometimes, over exercising, exercising like, for if I have eaten this, so I have to burn these many calories. All this, this becomes a very vicious cycle, and you use a lot of, somebody mentioned here laxative also, Alka mentioned, you use a lot of laxatives. Imagine, it's such a big self-harm which is happening and you are not aware. Because you are conditioned just, that overeating is because of that binge eating is because of some psychological issues or some genetic issues, but you are not aware. You are getting into a cycle of no end. And this bulimia is very, very dangerous. It can be fatal because it really affects your digestive system. It affects your kidney. You get dehydrated. You can faint. You have low blood pressure, and a lot of issues. It can damage your heart. It is so bad because and sometimes when you're putting your finger inside your throat, your digestive tract, this can be badly damaged. And your knuckles, sometimes your knuckle also has a lot of some kind of rashes and all. This is all what I was reading about bulimia. I am not kind of certified to know that what actually bulimia is all about. This is all my research, what I was reading around. And while reading, you feel, or by uh, thinking about this, it's such a sad feeling. And so many, I think, people are going through bulimia so much because it's very difficult to control, your eating habits till you are not, as very rightly said by Vartika, till you are not actually going into a therapy, you are not meeting the counselor, you are not going into a actual, right way to address it. It's really, really dangerous. Honestly, it's dangerous. It's fatal. This desire to lose weight, this desire to have that perfect body, uh, all this is really, really leading people to very, very serious eating disorders. Thank you, Pranati.
Thank you, Manju. So over to you, Devlina.
Manju's talks actually reminds me of a client of mine a couple of years back. She was this beautiful girl and very lean, very somber looking, and she had this peculiar calm composure about her. She was an artist. So she had those long, beautiful nails. And while we were in therapy, she was talking to me. I saw cut marks around here, and they were so raw, so sore. They were like, literally looked like as if like something had cut her. And how can something cut you uniformly? So I just thought of asking her, but I kept to myself. I was just thinking maybe like something she'll come up with something. And then finally towards the end of the session, I just asked her that why do you have these.
Okay. So I think Devlina has gone off. So while we wait for her to get back, over to you, Sanjita. Can you tell us a little bit about anorexia?
Sure. Hi everyone, this is Shanita here, and we are talking about eating disorder today. So anorexia is something we are seeing this thing in adolescents, girls, not in males, because we are living in such a society which always tell us to be thin, to be like a model one, Vogue model, or something like if you want to be like Deepika Padukone, you have to shed a lot of weight. So it is seen mostly in adolescents, girls. So it is like self-induced starvation. We have to look good, so we have to starve so much that our skeletal comes out. So it's like it starts with early puberty. Mostly adolescents, girls are being the people who are going through this severe weight loss, and mostly they have a fear of gaining weight, so they don't eat. And yes, Vartika said that about eating more, and as well as Manju said about laxative using, vomiting. Yes, those are the things they use. They after they eating, after the process of lunch or dinner, they put their fingers in so that whatever they are eating comes out, so that there is no food in the stomach. So mostly complications comes in period cycle, because this is the time when girls are maturing via hormones, all this. And the thing is that there are two types of management regarding this problem, eating disorder. One is short term management, another is long term management. Short term is that you have to come restore your normal body weight, which is the main thing. And second is normal eating habits, which should be done under the nutritionist, which is very important. Nutritionist is the one who can guide the person with good food habits. Balanced diet is the main thing in this. They should gain weight, not lose so drastically that they are having problems in various, like hemoglobin goes down, they are having kidney failures at the young age. So it is like that person should have treatment. First they should go for short term management, and then it's coming the long term management, that is cognitive behavior therapy. Everyone was telling about that only. Cognitive behavior therapy is the best way to erase the negative behavior, and through cognition we can go through it. And interpersonal psychotherapies, but for that they should go for a counselor who is good with all these things. Another therapy is there, that is family therapy, which is more effective in this reason. Why? Because they are moving in three phases. One is full parental control. That means, since we know these children, they don't want to eat, they are, as soon as the parents are going, they are vomiting, they don't want to keep their food inside them, they want their food should be out of their system. So parents should be guiding them, they should be taking the meal and should be volunteering that they should not do all these activities. Next phase is that gradually returning to the control to the adolescence. That means for some snacks, they are not having their parental control on the child, so that they should understand that this is good for me. Since my parents are not looking, I should not go in that area of vomiting and all those things. And last is the establishing healthy independence. That means when a child is able to eat with age appropriate and body appropriate food,
Thank you, Sanita, for sharing. I think there's a bit of a net connection. We'll come back to you. So, over to you, Kriti, now. What do you think about restrictive eating disorders? I would want you to tell us a little bit about that.
Sure. Thank you, Pragati. I think there has been a lot of valuable conversation that's gone around body image and eating disorders. And this is where I also want to now shift the conversation to restricted food intake disorder, which has nothing to do with a body image issue that the person faces. It's primarily extreme picky eaters or extreme selective eaters who develop this restricted food intake disorder. What happens is when a child, this happens normally in child when they are so fixated on eating a particular food group, they would never want to diverge from that. They would never want to try different things. And as they become adults, they slowly become afraid or fearful of that particular food group. It may be classified as a particular food, color of food, or it can be a particular snack item. It can be particular fruits like citrus fruits. So there are food groups which are aversive, and that's why they avoid eating that. Now, this has to be definitely clinically diagnosed using our DSM, and it's only after that you can be diagnosed as a food intake disorder, someone who has food intake disorder. I think there are lots of phases to the symptoms. There's a pre-symptomatic stage and there's a symptomatic stage. During pre-symptomatic, definitely there are things like if you're avoiding a food group, if you forget eating food completely, if you don't have biological hunger pangs, if there is a social isolation and you want to ignore places that would otherwise have food, and a dinner party or a lunch party, you would not want to go to that social event at all because you're afraid that you'll get food and you'll have to eat that. And once that becomes into a symptomatic stage, there is increased weight loss in adults. And for younger kids, they cannot, there's a failure of gaining that weight. So there is this very stark difference between the weight that's how they sort of impose on a person. I think definitely talking about therapy, first and foremost, since it's biological and since it's behavior oriented, it's going to be a mix of both your GP and your counselor's work. So the first suggestion would be go to a GP and get your vitamins, and he or she will prescribe your vitamins. That's going to get your hormones in check, and then it's going to regulate biologically. And then definitely go to a counselor who, it's ideal if you go to a counselor who practices eating disorder therapy, like who is specializing in eating disorder. But even if you see someone who is subscribing to CBT, which is as everybody suggested, cognitive behavior therapy, or even exposure therapy, which is it's a popular research that once you expose a client to certain food groups or certain phobias that they carry, there is lessening of that particular phobia. So exposure therapy, family-oriented therapies. So these are very scientifically proven methods to bring the person up to speed with what is it that the behavior is wrong, and then they can rectify that in therapy. So I hope this is providing some sort of clarity to everybody. Back to you, Pragati.
Thank you, Kriti. Thank you all panelists. I think it has just been nice. Today we've been facing a bit of the internet issue, but that's all right. So any last words that anyone wants to talk about before we wind up our session? Yes, Alka.
I'd just like to add that there's so much of eating disorders going on, and it's mostly because the people who are doing it or experiencing it is mostly it stems from either childhood abuse or some kind of body shaming. Mm-hmm. So I would just tell everyone that if you can't say something positive, don't say negative about anybody's, appearance or weight. Mm-hmm. Make your weight your business. Others' weight is none of our business. If we just keep that in mind, it'll go towards a lot of well-being of everyone concerned. Thank you.
Thank you, Alka. Anyone else who wants to say something? So thank you, panelists. And before we wind up, I have an announcement regarding our Saturday session. Every Saturday from 12 to 1:30, we have a self-development session. This Saturday, we have on a topic called Living in Harmony. It's really, really pertinent, and we would like all of you to join in. If you want further details, do contact us on 98301 49919, and we'll give you details. So see you again next Wednesday with a live where any pertinent topic to mental health will be covered. Have a great day and good night, everybody.